So in terms of what this all means, when we look at Black men, unfortunately, in terms of health outcomes, we have the lowest rates. So we have the highest rates of diabetes, highest rates of hypertension, obesity, heart disease, colon cancer, prostate cancer, especially when we compare it to white men. Unfortunately, also, we have, when we do get prostate cancer or colorectal cancer, statistics show that we're more likely to have an aggressive disease, as well as we're more likely to die of these problems. So it's a significant problem.
Okay.
When we talk about screening, and this is outside the prostate, I want to talk about some things that are also common, such as high blood pressure, diabetes, and colorectal cancer. And it's so important for us men to understand what the screening process is like. So the screening process starts with your family history. So if you have a family history of high blood pressure or diabetes or colon cancer, you should really be talking to your doctor about getting screened. Okay. If you're exhibiting symptoms such as a headache or blurred vision, that might be a sign of high blood pressure. If you're going to the bathroom frequently, and if you're going more urgent and you're thirsty, that might be a sign of diabetes. If you're having blood in your stool, that might be a sign that you have colorectal cancer. So the screening tests that we do, for high blood pressure, we want to get our blood pressure checked. And so that's going to your primary doctor on a yearly basis and them checking your blood pressure. For your glucose levels, it's a simple either a blood test or a finger stick, and that'll allow us to see if you have early diabetes. And for colon cancer, what we want to do is we want to get a colonoscopy. And for most men, that's about 50, unless you have a family history or unless you see blood in your stool or what have you. Then you want to make sure you get a colonoscopy, and you'll see a gastroenterologist for that. But first, you want to go to your primary care doctor. Okay. So currently there are hundreds of trials for prostate cancer. Obviously, first you're going to be diagnosed with prostate cancer. You'll be in that low, moderate, or high risk category. And then from there, I would talk to your primary care doctor, or I would talk to your urologist to see if there's any trials that they're participating in, or maybe they can recommend some trials that you can possibly participate in. There's a lot of other information out there. One is bmsstudyconnect.com. So there's trials that are there. If you look through the trials and you're not eligible for some of those trials, there's clinicaltrials.gov, which is also available.